Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam.
Okay, so this is one of the skill stations for OSCE, completing a fluid balance chart. I'm just going to talk you through what to do. So in the exam you'll be given a summary which will look something like this. And here you can see all the patient's details, what they've drunk, any IV fluids, their output, and here we've got urine output, there might be bowels, drains or gastric losses, which is like vomiting. And all you have to do for the exam is transfer this information onto your fluid chart, which I've got here, and calculate the positive or negative balance. So start with writing your patient's details and hospital number. And one way I found myself easier to complete this chart to make sure I don't make any mistakes is do it like this, get another piece of paper and put it on top and just write down line by line so you make sure you've written everything. So we can see at 2 o'clock my patient has drunk 20 mils, so I'll just put 20 mils of oral intake. So the hourly total for that hour should be 20 mils, but I'm just going to check she hasn't got any IV fluid as well before I calculate that. And again, 4 o'clock, she's drunk another 20 mils. And you have plenty of time, so this station is 15 minutes, so definitely double check your chart. And as you can see, this fluid chart starts at 8 in the morning and finishes at 7 the next day, unlike our normal fluid charts we use in most hospitals, which start at midnight and finish at midnight, so just to be aware of that. Okay, so I've entered all of my patient's oral intake. I can now see that she's had some normal saline and the perienteral fluids. So she's had a litre which started at 7 and finished at 5. So I now need to calculate how much went in every hour. So first I need to calculate the difference between 7 and 5, how many hours that is. So that's 8, 9, 10, 11, 12, 1, 2, 3, 4, 5. So that's 10 hours. So this is a 10 hourly bag. So obviously you will be provided a calculator in the station. So I would do 1,000, which is the amount given, divided by 10, which is the number of hours, which obviously is 100 mils per hour. Then to write this, record it on my chart, I would start at 8 o'clock because the first, obviously the bag of fluids has been put up at 7, but by 8 o'clock she would have received her first dose, so we start from the next hour every time. Also we need to write what fluids it is, so here we'll just write normal saline, and then I need to write that right the way up until 5 o'clock, so 10 times. I'm just going to check that I've written that 10 times. So I'm happy that's correct. Now I'm going to fill out my hourly input and my total input for my input section. Afterwards I'm going to move on to my output. So for the first hour of 8 o'clock, my hourly total is 100 because she's only had 100 mils IV and she hasn't drunk anything. The same for, and then my total for that would be 100. So for 9 o'clock again, the hourly total is 100. The total overall would now be 200 because I've done 100 plus 100. Again, the same for 10 o'clock, which would make 300, and so on. So at 2 o'clock, you can see my patient has drunk 20 mils and she's also had 100 mils IV. So I would add those together, which is 120 to make my hourly input. And then I would add that onto my hourly, my previous total to make 720. 3 o'clock she's only had the IV fluid, she hasn't drunk anything. And then again the same at 4 o'clock, she's also had 20 ml of water. Sorry, so that would make 940. Here again, so this will now make 1090. Again, she's had 100 ml here, so that would be 200 ml here. I hope you can see this. I know it's not very clear. So this hour she hasn't drunk anything, so don't necessarily have to fill it out. Okay, I'm just going to check that on the calculator because I'm not sure. So you won't be penalised in the exam for using the calculator, just use it to help you because it is there. And I would, at the end, I would double check all my calculations on the calculator just to be 100% sure. Okay, so I've now finished my input section of my chart, and I'm going to move on to the output section. So again, the way I find easiest with this is to do exactly the same, do each bit line by line. Obviously you don't have to do it this way, but this is what personally I think is easiest. So 100 ml of urine, and they've also had 100 ml of gastric loss. And then at 10 o'clock they've had 50 ml of gastric loss. 9 o'clock they've had 200 ml of urine and 50 ml of gastric loss. Okay, and then I make the hourly total exactly the same as I did with the oral intake. So for the first hour at 8 o'clock they've passed 100 ml of urine, and they've also had 100 of gastric loss, so that would be 200, and the total output so far would be 200. Don't worry about minusing this from your input just yet, you just need to do that at the end. So then my next one is 50 ml of gastric fluids at 10, so that would make 250. And just complete it exactly the same as the other one. Okay, so once you finish that, you've got your total input is here and your total output is there. So obviously sign your name. Okay, so to calculate our fluid balance, we need to take the input, which in this case is 2,140, and minus the output, which is 2,000. Okay. I'm going to use the calculator here just to make it easier. Okay, so my total balance is 140, which is positive. The reason I know this is positive is because the number is still positive. Obviously, if I had like 3,000 as my input and 4,000 as my output, that would be negative because it would give me a negative number. A minus number, and I would write negative there, and that's all you have to do for your exam.